Welcome back to the Deep Dive, where we pull the most important insights from a huge stack of sources and deliver them straight to you.
Today, we are taking a really comprehensive look at rheumatoid arthritis, or RA.
That's right. This condition affects millions of people all over the world, and for a long, long time, the outlook felt, well, it felt pretty bleak. Almost like a slow, painful, inevitable decline.
But that's just not the case anymore.
Not at all. Our sources are really clear that modern medicine, when you combine it with what we now understand about lifestyle and diet, has completely changed the story.
So our mission today is simple.
We want to give you a definitive, actionable deep dive into RA. We're going from its core mechanism all the way to the specific tools you can start using right now to manage symptoms.
And dramatically improve your quality of life. The consensus in the research is clear.
RA does not have to be an obstacle to living a full life. It might make things, more uncomfortable, more difficult, but it doesn't have to stop you.
Okay, so to build that foundation, we have to start with what RA is at its very core. It's classified as a chronic inflammatory disease.
But the root cause is an autoimmune disorder, right?
Exactly. Think of your immune system as your body's security force. Normally, it's incredibly well trained. It knows how to recognize and protect all of your own structures, your tissues, your organs.
It knows what's you.
It knows what's you.
Okay.
But in rheumatoid arthritis, that whole system becomes profoundly disoriented. It just loses the ability to tell friend from foe.
So it starts attacking the body it's supposed to be protecting.
Yes. It turns on itself, it begins to attack its own tissues, and that attack creates this state of chronic inflammation.
Yeah.
And while it can affect the whole body, the main focus of the damage, especially at the beginning, is the joints.
Okay, let's unpack that because the specifics of how it affects the joints are often what people notice first.
Right.
So when a joint is under this kind of attack, what are the classic immediate signs?
You see the 5 hallmark signs of inflammation. There's pain, stiffness, swelling, or tumefaction is the clinical term.
Tumefaction, okay.
And then redness and heat. The joint is literally signaling that it is actively under attack.
And what we found really fascinating in the material is the pattern. It doesn't just start randomly, does it?
No, not usually. The pattern is actually quite specific, which is a big help in diagnosis. It generally starts bilaterally.
Meaning in pairs.
In pairs, exactly. So matching joints on both sides of your body at the same time. And it tends to go for the smaller joints first.
So like your knuckles.
Exactly. The knuckles where the fingers meet the hand, or the same joints where your toes meet your feet.
And only later does it move to the bigger joints.
That's a typical progression, yes. As the disease gets more established, it starts to affect the wrists, the elbows, the shoulders,
And in the lower body.
the ankles, the knees, and the hips.
It's also really important to understand that the disease course isn't just a constant downhill slide. It works in cycles.
Precisely.
Yeah.
It happens in what we call outbreaks, or peaks of intensity.
Flare-ups.
Flare-ups, yes. And these are followed by periods of remission where the symptoms can lessen, or sometimes they can even seem to vanish completely.
But during those flare-ups, it's not just the joints, is it? The whole body feels it.
Oh, absolutely. The general systemic symptoms are profound. You're looking at a severe, just crushing fatigue, a total lack of energy, this feeling of malaise.
Like having the flu.
Very much so. Sometimes even a low-grade fever and a really noticeable loss of appetite. It's a full-body illness.
Okay, and here's where it gets really interesting. This is a key takeaway for anyone listening who's trying to figure out if their pain is RA or something else, like normal wear and tear osteoarthritis.
This is a vital clue.
The pain from RA is characteristically more intense after rest, after you've been inactive.
Yes, like when you first wake up in the morning, or even after sitting still for a long meeting. That's when the stiffness and pain are at their absolute worst.
We hear the term morning stiffness a lot.
And it can last for hours. It's not just a 5-minute thing.
Whereas with osteoarthritis or arthrosis, the pain usually gets worse with activity, right?
Exactly. The more you're on your feet, the more it hurts. So if you're trying to figure out your symptoms, just remember, if the worst pain hits you when you start moving, that's a big red flag for RA.
Now, moving beyond the joints, the source material is adamant about this. RA is a systemic disease. It's highly variable, and it affects so much more than just your knuckles.
Absolutely. The chronic underlying inflammation is the real problem, and that can impact, well, pretty much any organ system. It can hit the bones, the mouth, lungs, heart, even the nervous system.
Can you walk us through what that inflammation does over time? Because it's not just about pain, it's about actual physical damage.
That's correct. Those repeated cycles of inflammation, the flare-ups, they lead to more and more joint wear. And eventually that can result in visible deformity and a real stiffness or rigidity.
And what about the bones themselves?
Well, that same chronic inflammation also triggers significant bone involvement.
Mm.
It very frequently leads to osteoporosis.
So a loss of bone density.
Yes, which makes fractures far more likely. That's a connection a lot of people miss. They focus on the joint cartilage, but not the bone underneath.
What about some of the more distant effects? The lungs, for example.
In the lungs, we see inflammation, but just as importantly, we see the body's attempt to repair that inflammation. And that repair process can create scarring.
Fibrosis.
Pulmonary fibrosis, yes. If you get too much scarring, it actually reduces the available airspace in your lungs, and that can lead to some serious respiratory problems.
And we also see these things called rheumatoid nodules.
We do. They're small, firm, little balls of tissue. You can see them on an x-ray of the lungs, and sometimes you can actually see them under the skin, especially over pressure points like the elbows.
The sources also note that the cardiovascular impact is very serious.
It is the main long-term concern that body-wide inflammation contributes to what we call arterial stiffness, basically a hardening of the arteries, and it can cause inflammation of the heart's lining, which is called pericarditis.
And then there are those strange effects like dry mouth and dry eyes.
Yes, that's from the immune system attacking the lacrimal and salivary glands.
And sometimes the nervous system gets involved.
It does. A very common example is in the wrist. All that inflammation and swelling can start to compress the main nerve running through the carpal tunnel.
Leading to carpal tunnel syndrome.
Exactly. That pins and needles feeling, or sometimes a complete lack of sensation in your hand.
Now, we mentioned the disordered immune system. The sources point to an association with a specific cancer, lymphoma. Why is that?
This is a really critical point. When your immune system is constantly hyperactive and, well, disordered, the risk for certain cancers that are related to the immune system goes up.
And lymphoma is a cancer of the immune system.
It's a cancer of the lymphatic system, yes. So that risk increases. And on top of that, the overall compromised state of the immune system just makes people with RA more vulnerable to infections in general.
So given all these serious systemic risks, let's talk about prognosis and quality of life. The statistics were genuinely shocking.
They are. The combination of chronic pain, the functional limitations, and that crushing fatigue, it severely impacts a person's social life and their ability to work.
The number I saw in the European studies was 40%.
A striking 40% of people with RA have to stop working entirely because of the disease.
40%. And RA often hits people in middle age, right when they're at the peak of their careers. The ripple effects of that are just massive.
They are. And when we talk about longevity, the data shows RA can shorten life expectancy by about 3 to 7 years.
And that's primarily from the cardiovascular issues?
Overwhelmingly from cardiovascular causes and that increased risk of lymphoma.
So what stands out here, and this is probably the most vital prognostic factor in all the sources, is that the amount of time you spend with the disease untreated is what does the most damage.
Yes, the duration of that unchecked raging inflammation is highly, highly detrimental.
Which means an early diagnosis and getting on a comprehensive treatment plan as fast as possible isn't just a good idea, it's essential.
It is a race against time. You had to stop the inflammatory process before it causes permanent damage.
Okay, so let's pivot to those comprehensive treatment pillars. The first line of defense is usually conventional pharmacology, isn't it?
Correct. The goal is twofold. You want to manage the symptoms, but you also want to rebalance the immune system.
So that involves things like analgesics and anti-inflammatories?
Yes, but also more specialized drugs. Immunosuppressants and what we call disease modulators, which are designed to try and restore some order to that rogue immune system. And of course, for severe local issues, injections or even surgery might be needed.
But beyond the clinic, the sources gave us some really specific practical things you can do at home. Let's talk about temperature. When should you use cold and when should you use heat?
Okay, this choice depends entirely on what the joint is doing at that exact moment.
So if it's in an active flare-up?
If it's actively inflamed, so it's red, it's visibly swollen, it's hot to the touch, you need to use cold.
Why cold?
Cold reduces that active inflammation and it provides some pretty immediate pain relief. A simple bag of frozen peas wrapped in a towel is perfect, actually. It conforms to the joint really well.
And what if the joint isn't hot and angry, but just stiff and rigid?
Then you switch to heat. If you're dealing with that deep stiffness or rigidity, what's sometimes called ankylosis heat, Helps to relax the muscles, it lightens that heavy feeling in the joint, and it can help you gain back some mobility.
What are good sources of heat?
A seed bag you can warm up in the microwave is great, or even just a warm, damp cloth that's been wrung out well and wrapped in another towel.
Now, there's a very specific safety note here that needs explaining. The sources say to avoid electrical heat, like an electric blanket. Why is that?
This is a really crucial distinction because RA is a systemic organic disorder. It affects the body's fundamental cell function. Introducing an external electrical current, even the low-level one from a heating pad, could potentially interact negatively with those underlying cellular processes.
So it could actually make the inflammation worse.
Potentially, yes.
Wow.
It's best to just stick with natural, non-electrical heat sources to be safe.
That makes a lot of sense. And for daily living, the sources also stress the importance of small, practical tools.
Oh, absolutely. We're talking about assistive devices, special grips to help you hold a fork, tools for buttoning a shirt, supportive bandages, cushion pads for your chair. These little things make a huge difference in your day-to-day ability to function.
Okay, let's move to the lifestyle pillars. The sources identified two major controllable risk factors that are directly tied to RA, and they say these have to be addressed immediately.
These are the non-negotiables.
Smoking and excess weight or obesity.
That's it. We can't change the risk factors of being female or middle-aged, but quitting smoking is essential, and so is reaching and maintaining a normal, healthy weight. These two things are just massive drivers of systemic inflammation.
And central to controlling both weight and inflammation is diet. Adopting an anti-inflammatory diet is fundamental, isn't it?
It is, because the food we eat directly modulates both our immune system and that whole inflammation cascade.
So where do we start? What needs to go?
First, you have to be aggressive about cutting out pro-inflammatory foods. That starts with anything with a high glycemic index.
So sugar.
All refined sugar, sodas, sweets, refined white flours, so things like white bread, pizza, and even high-sugar fruits. They cause a sharp spike in blood glucose, which just activates the entire inflammatory cascade.
And the other big category to avoid is certain fats, specifically those high in omega-6.
Right. We need to cut way back on unhealthy animal fats, things like bacon, processed meats, and also industrial vegetable oils like palm, soy, corn, and those refined seed oils. And another point, avoid cooking at really high temperatures. Gentle methods like steaming or boiling are much better.
What's fascinating here is that the direct link the sources draw between RA and the health of your gut. They talk about hyperpermeability, or what most of us call leaky gut.
Yes, the integrity of your intestinal barrier is just paramount. If that lining becomes too permeable like a screen with holes in it, things that are supposed to stay inside the gut leak out into the bloodstream.
And that triggers the immune system.
Activates the immune system and just pours fuel on the fire of systemic inflammation.
And the sources pointed to two major intestinal irritants that people with RA really need to manage.
Yes, the big two are gluten, which is mainly in wheat, and milk, especially non-fermented dairy. These are known to directly damage the gut lining and unbalance the immune system. For many people, minimizing or completely avoiding them is essential.
And beyond specific foods, we also have to minimize toxins.
Absolutely. Herbicides, pesticides, food additives,
Yeah.
they all further activate inflammation. So choosing organic whenever you possibly can is a really effective strategy.
So to summarize the ideal diet, we're aiming for something natural, varied, local, seasonal, a Mediterranean-style approach.
Exactly. A diet that's rich in cooked vegetables, low glycemic fruits, poultry, and very little red meat. Ideally no more than once a week.
And lots of healthy fats and fibers.
Plenty of fish, seafood, nuts, seeds, properly prepared legumes, gluten-free grains, herbs, and spices. And do not forget hydration. Staying well hydrated helps your body eliminate toxins and can even alleviate joint pain.
Let's dig into a couple of critical dietary nuances that are often overlooked. First, solanine.
Solanine is a hidden trigger for many people. It's a compound found mainly in the skin and seeds of nightshade vegetables.
Which are tomatoes, potatoes, peppers, and eggplant.
Right. And for people who are sensitive, it can directly activate inflammation and damage joints.
If someone just can't give those up completely, is there a way to minimize the impact?
Well, the solanine content is reduced by cooking them really well, peeling them, and removing all the seeds. But the strong recommendation is to avoid them completely during a flare-up, and if you know they're a trigger, maybe avoid them entirely.
And what about dark leafy greens? We think of those as being super healthy.
They are, but we have to manage oxalates. These are found in vegetables like spinach and kale, and they can also activate inflammation. The key is that their content decreases when you cook them, so they really shouldn't be eaten raw in large quantities.
And the last one is lectins.
Lectins are everywhere. Legumes, cereals, milk. They're another inflammatory trigger. For anyone with RA or a family history, the advice is to minimize them. Or if you do eat them, make sure they are very, very thoroughly cooked to neutralize the lectin content.
Let's quickly run through some key beneficial supplements that can support all these dietary changes.
Vitamin D is absolutely critical, specifically the combination of vitamin D3 with vitamin K2. D3 helps with inflammation and immunity, and K2 is vital for making sure calcium goes into your bones and not into your arteries or joints.
It's a powerful synergy. What else?
Omega-3 fatty acids from fish or krill oil are powerful anti-inflammatories. Evening primrose and borage oil have also been shown to help.
And for the gut.
Prebiotics and probiotics. They're essential for regulating your gut flora, which we know is directly tied to the disease. And finally, curcumin from turmeric. It's a potent natural anti-inflammatory, often used for pain relief.
Okay, our final pillar, activity, stress, and sleep. We know movement can be agony during a flare-up, but physical activity is still vital, isn't it?
It is fundamental. Consistent, appropriate activity prevents more joint deterioration, it improves your ability to function, and it provides a direct boost to your energy level and your mood, two things that RA just relentlessly chips away at.
What counts as appropriate activity?
Low impact is the key. So things like walking, dancing, tai chi, or gentle yoga and Pilates, always with good cushioning. A word of caution on swimming, though.
Because it's low impact, but...
But the cold, humid environment of a pool can often make joint pain worse for some people, so it's something to approach with care.
And we can't ignore the emotional side of this. The sources note a very high frequency of depression and anxiety.
And untreated depression in someone with RA is disastrous. It's a vicious cycle. It makes the treatment less effective, it increases the perception of pain, and it multiplies the risk of cardiovascular complications. You have to treat the mind to treat the body.
So how do we manage stress, which we know just makes all inflammatory symptoms worse?
Mind-body techniques are essential. Things like conscious breathing, meditation, visualization, and something called cardiac coherence.
Cardiac coherence.
It's a practice of regulating your breathing to calm your nervous system, which in turn reduces stress hormones and inflammation. These techniques are crucial for managing stress and for improving sleep quality.
Which is when the body does all its repair work.
Exactly. Good sleep hygiene is non-negotiable. Stick to a routine, avoid screens before bed, keep the room cool and dark. Restorative sleep is fundamental for managing any chronic inflammatory condition.
This has been an incredibly powerful deep dive. To synthesize everything, managing RA requires this coordinated three-pronged attack, the right medications and remedies, a very targeted anti-inflammatory diet, and meticulous management of your lifestyle activity, stress, and sleep.
The approach has to be comprehensive. And this raises an important question that you, the listener, should really take with you.
Okay.
We've established that cardiovascular issues are the primary factor in shortening life expectancy in RA. We also know that diet and activity are incredibly powerful tools for controlling inflammation and weight. So the question is, how much of a double shield can rigorously adopting this anti-inflammatory lifestyle truly provide against the most severe long-term risks of RA?
In other words, how much can you change your own long-term prognosis?
Exactly. Consider how applying this knowledge can dramatically shift your future.
That is a powerful final thought. Thank you for joining us for this deep dive.